Okay, let's talk about ondansetron. Ondansetron, also known as Zofran. Zofran is a serotonin antagonist. So it antagonizes serotonin. It competes for the serotonin receptors. So, knowing that, let's get a little bit more specific. Let's spell this correctly as well. Serotonin. Okay, so our action is it selectively blocks the 5-HT3 serotonin receptors. Including those found in the CTZ, and what did we say the CT was? Was the chemoreceptor target zone in the medulla that controls vomiting or induces vomiting. Based on the chemical profile within the blood or the medications within the blood, what have you. This center is what makes you want to puke. Okay, and this also blocks the 5-HT3 receptors at the vagus nerve terminals. Okay. So we're selectively blocking 5-HT3 serotonin receptors, including those found in the CTZ and the vagus nerve terminals. Okay, so we know the vagus nerve, nerve number 10, innervates almost everything, right? It's got its little tentacles everywhere in the body, especially the heart and the gut. So in this case, we're helping it block stimulation to the gut. What are our indications for Zofran? Well, nausea and vomiting. If a patient is nauseous, this will help with the nausea. If they are vomiting, hopefully it will stop the vomiting, but that is not always the case. So just know that to be true. Sometimes it doesn't work. If they're nauseous, yes. I have not had it stop nausea, or I've not had it fail to relieve nausea. However, once they're vomiting, I have had it fail to relieve vomiting, that they continue to vomit following it. Some people are just like that. Just like every other drug, some things just don't work well. Okay? So, nausea, vomiting. Our dosing is 4. Okay, let's be real here, guys. 4 to 8 is an adult dosing. Kids, it can go all the way down to half. Well, I've never seen it down to half. We'll just call it 1 to 8 milligrams. And it's available IV, IM, or PO. Okay? So 1 to 8 milligrams. We've got to include kids in there. Of course, per local protocol, this could include a call-in order and able to give it to a kid, to a pediatrics patient. So don't just assume that you can give 1. Follow your local protocol. However, you may see dosages that low. What are our adverse effects? dizziness and lightheadedness. What's our contraindication? Allergy to the medication, hypersensitivity to the medication, or allergy to the medication. Okay? So our adverse effects, dizzy, lightheaded. I've never had a patient, whoop, not high, lightheaded. I have never had a patient complain of either one of those side effects. Never. Doesn't mean it doesn't happen, because obviously it has at some point, but I have yet to hear that complaint from anybody in the emergency room or on the ambulance when I've given it. Okay, so this is a very widely used medicine. It is very good at what it does. It comes in a syrup form for kids. It's not highly recommended in the children's hospital. They did not like giving it because it was a very large volume of liquid to give for such a small dose. And it was a syrup. It was very sweet, very upsetting to the stomach, actually. So a lot of kids that I gave this to as an oral syrup, it actually caused them to vomit. So you've got your IV dose, your IV vial, your IV, it can be given by IV or IM. Takes a little bit longer to take effect IM, however, we know this because it has to absorb through the muscle. And you can take this PO or sublingual. So you can take a regular pill and have it work that way, or there is the Zofran ODT that's sublingual and dissolves under the tongue much like nitroglycerin does. So those are the things. It is widely used in emergency services because it is a safe medication that has very, very, very few adverse effects, very, very few side effects, if any, and it does well at what it does. It relieves nausea and vomiting.